Missouri's only federal family planning organization under Title X, the Missouri Family Health Council, is facing a funding freeze. KMUH's Jocelyn Pisha spoke with its director and the CEO of Planned Parenthood Great Plains to see how patients receiving contraceptives and cancer screenings could be impacted. Jocelyn?
The Missouri Family Health Council, or MFHC, has until tomorrow to send information to the Department of Health and Human Services. They're trying to receive their already pre-approved $8.5 million grant for the year, but HHS has said the funding is paused for MFHC and 15 other organizations nationwide, pending a compliance review. Patients needing family planning care are feeling confused.
They don't understand what services are covered or not. So we're doing a lot of explaining and also a lot of apologizing.
Funding is paused for Missouri's only Title X organization, which provides services like birth control, STI testing, and cancer screenings. But clinics like Columbia's Planned Parenthood are still serving patients and trying to get funding back.
We are not at this time planning to suspend services, but already it's hard for Missourians.
The Missouri Family Health Council operates 52 clinics in Missouri and Oklahoma, serving 35,000 Missourians in 2024. MFHC was on year 4 of a 5-year funding plan, but last week, Health and Human Services sent notice that $8.5 million in funding is, quote, paused pending a compliance review, end quote. HHS requested more information about a job posting from 2 years ago with DEI wording, which was no longer on the website.
Many of the instances in which for us and for other health centers that have these supposed compliance concerns, they are referencing things that have happened in some cases over 5 years ago.
The MFHC is working to get information to HHS by April 10th. That's this Thursday. And today, their director went to the state capitol to advocate for access to reproductive health care, which has been a struggle for Missouri organizations in recent years.
Clearly, this feels like a political attack and does not actually have anything to do with they're coming after our birth control and doesn't actually have anything to do with any compliance concerns. And so this feels like just the beginning of many more potential negative impacts that will come.
The MFHC director says this move by the Department of Health and Human Services is outside of the established process, as funding is not typically withheld. She also added that rural locations could be strongly impacted if the freeze continues, as they rely the most on federal dollars. In the studio, Jocelyn Pisha, KMU8 News.